ਫੈਡਰਲ ਸਿਹਤ ਮੰਤਰੀ ਜੀਨ ਯਵੇਸ ਡੁਕਲੋਸ ਨੇ ਕੈਨੇਡਾ ਵਿੱਚ HIV ਟੈਸਟਿੰਗ ਦਾ ਵਿਸਥਾਰ ਕਰਨ ਲਈ ਲਗਭਗ $18 ਮਿਲੀਅਨ ਦੇ ਫੰਡਿੰਗ ਦਾ ਐਲਾਨ ਕੀਤਾ ਹੈ। ਫੰਡਿੰਗ ਦਾ ਇੱਕ ਵੱਡਾ ਹਿੱਸਾ ਸਵੈ ਪ੍ਰਬੰਧਿਤ ਕਿਟਾਂ ਵੱਲ ਜਾ ਰਿਹਾ ਹੈ। ਡਕਲੋਸ ਨੇ ਮੌਂਟਰੀਅਲ ਵਿੱਚ 24ਵੀਂ ਅੰਤਰਰਾਸ਼ਟਰੀ ਏਡਸ ਕਾਨਫਰੰਸ ਵਿੱਚ ਕਿਹਾ ਹੈ ਕਿ $17.9 ਮਿਲੀਅਨ ਵਿੱਚੋਂ $8 ਮਿਲੀਅਨ HIV ਸਵੈ ਟੈਸਟਿੰਗ ਕਿਟਾਂ ਨੂੰ ਖਰੀਦਣ ਅਤੇ ਉਹਨਾਂ ਨੂੰ ਕਮਿਊਨਿਟੀ ਸੰਸਥਾਵਾਂ ਵਿੱਚ ਵੰਡਣ ਵੱਲ ਜਾਏਗਾ।
In Canada, we know that removing the barriers to care and ensuring everyone has equal access to HIV prevention, care, and support is key to reaching our shared goals of 95, 95, 95 by 2025, and ultimately ending HIV as a public health concern by 2030. It gives me hope to think of how far we have come. Today, HIV is a manageable condition when diagnosed and treated early. And with the evidence showing that antiretroviral treatment can prevent transmission to other people, there is even more reason to be optimistic. We have made real progress over the past 3 decades, and we won't stop now. One pandemic cannot overshadow another. Yes, we've come a long way since the 1980s, but we know that much more needs to be done. I hear you. The entire government of Canada hears you. I hear your anger and anxiety. And I also hear your hope. Hope that we can do better if we work together. That hope and hard work is what we want to focus on. Together, let us re-engage, follow the science, and carve the path towards a world without HIV/AIDS. We know that in our fight against AIDS, we must be guided by actual lived experience. And it is why we need to recognize those living with HIV in this very room today. Those loved ones we have lost through inaction, and those long-term survivors who continue to inform and shape our path forward. It is an honor for all of us, and for me certainly, to be here at the Canada Pavilion, where the remarkable work of community organizations is on full display as we commit to the theme of the pavilion: solidarity, science, and support. COVID-19 has obviously impacted our HIV response here and everywhere. Recent survey data from Canada has shown that the COVID-19 pandemic has negatively impacted the delivery of and access to services for sexually transmitted and blood-borne infections, including testing. Lessons learned through Canada's pandemic response provide new opportunities, however, for innovative approaches to reaching the undiagnosed in Canada and meeting new targets established for HIV. AIDS 2022 has given us the opportunity to reorganize our efforts to concentrate on what we must do to end the AIDS pandemic. Canada and the world is now focused on this goal. We know that HIV is preventable, yet the rates of HIV infections remain high in Canada and in other countries. Providing individuals with access to testing, treatment, and care can help reverse this trend. Removing barriers is the key to ending the AIDS pandemic. Through the pandemic, we've had to innovate to reach people and connecting them to care. Now we are taking the lessons from this other pandemic and applying them to our own AIDS efforts. For example, Canada's National Microbiology Laboratory has been working closely with Indigenous communities in northern, remote, and isolated settings to equip them with the tools and training they need to be able to perform testing for infectious diseases. This has enabled a culturally responsive, community-led, and community-based response to healthcare in those communities, empowering them to determine their own path forward. And that holds so much potential for the HIV response.